Hospitals have great people working in them, but often we work around really tough systems. The integrated management system is an approach that actually connects all parts of the organisation, what I call from the board to the ward.
So the integrated management system is our operational engine, and it's the mechanism for how we run our business. It connects the organisation at all levels, and it recognises that at a unit or department level is where the action happens, and that's where we really drive performance and impact on the patient experience.
The way we've organised that is around 5 particular areas or domains, we're calling them. The first is staff safety. The second is quality and experience of patient care. The third is delivery of our services. The fourth is about our great people. And the fifth is about cost or financial sustainability.
The foundation of the integrated management system is tiered huddles, and we have tiered huddles at all levels of the organisation.
At the huddle, we reflect on our performance and how we're tracking against our KPIs. We talk about our successes and recognise things that we're doing well. We talk about problem solving and issues that need resolving on the ward. We talk about planning, how prepared we are for today and how prepared we are for tomorrow. And we also talk about ward communication.
Tier 2 gives us the opportunity to hear about and know about what the issues are across the whole organisation and to mobilise our resources to help solve those problems on the day they arise.
For me, particularly coming to Tier 3, what I see is what's happening around the whole organisation. So it is better visibility across the organisation. I see what's happening in other divisions. I see how it affects our work, but how it's affecting other people at the same time in areas that I might not have been looking at or understanding at that time.
Through the rollout of the integrated management system, we've invested in our unit level managers to build their capability to manage their business and become mini CEOs of their units.
What the daily management system has helped me do is bring the staff together. We've got this open forum, we've got open discussion, and we're all able to engage with the vision. We've seen improvements across the board, which has just been really fantastic. But the thing I'm proudest of is that there are improvements not just in delivery, but also the quality of care that we're giving for our patients. We've seen 38% increase in use of the transit lounge, 72% increase in compliance with bedside handover, and a 5% reduction in length of stay, which are all massive. There's been a real cultural shift that we've seen. Staff feel heard, staff feel empowered to solve problems themselves, and I think really just take ownership of the ward and the work that they're doing. And I think that's really what's going to make it sustainable for us.
What we've been able to do is establish really clear lines of communication, and we've seen a better engagement from our workforce.
We've improved our staff engagement and our work within the multidisciplinary team by having all disciplines included in the daily huddle. We have had major improvements on our ward in terms of increasing our discharge numbers by 10 a.m. and implementing bedside handover across all 3 shifts.
When you come together as a team, I guess there's a shared vision of what we're trying to achieve. There's a process around that people understand what they're trying to do, what that team's looking at. They see how other groups are working in that same direction, and then they come back and relook at it again on a day-to-day basis or a week-to-week basis intermittently, so that it's integrated. It's an integrated management system.
What's been fantastic at SALHN is the absolute connection with staff. I've seen people who felt disempowered previously actually being able to make different decisions, seeing what I call really tough problems that have been around for a long time solved. It's a great connection between the executive, the management, the staff directly on the ground, across all of the different professional groups and clinical groups and non-clinical services as well. That's the most exciting thing about the integrated management system, is actually seeing people empowered, making decisions, solving problems, and actually feeling good about their work.